Well, good evening. I'd like to call this meeting of the Gilbert Governing Board to order. Today is Tuesday, January 26th. I'd like to start with item 1.02, a moment of silence, followed by the Pledge of Allegiance led by Mr. Carr. Would you all please join me in a moment of silence?
Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Carr. We're at 1.04. A roll call. Ms. Wilson, would you please do the honors?
Ms. Laurie Wood. Here. Dr. Charles Santa Cruz.
Here.
Mr. Reed Carr.
Here.
Ms. Sheila Ugeti. Here. Ms. Jill Humphreys. Here. Mr. President, all board members are present. You have a quorum.
Thank you, Mrs. Wilson. We're at item 2, approval of this evening's agenda. Item 2.01, is there a motion?
Dr. Santa Cruz, I move that we approve tonight's agenda.
Thank you, Mr. Carr. Is there a second?
Second.
Thank you. Is that Ms. Wood? Ms. Ugeti? Any discussion? Seeing none, then we will vote on the approval of this evening's agenda. All those in favor, please signify by saying aye.
Aye.
Those opposed, the same. Motion carries 5-0. Item 3 is the superintendent's recognition and awards. Item 3.01, Dr. McCord.
Thank you, Dr. Santa Cruz. Governing board members, tonight we'd like to recognize several students and staff for some of their accomplishments of late. Tonight we want to talk about the district spelling bee winners. 8 students will be representing Gilbert Public Schools in the regional spelling bee hosted by Chandler Unified School District on February 16th, and this will be a virtual bee. For this year's winners, in order, first place was Arian Rivera Torres from Playa del Rey, 4th grader. Second place was Sammy Martel, a 6th grader at Val Vista Lakes. Third place was Tyler Mantanona from Canyon Rim, a 6th grade student. Fourth place was Regan Van Patten from Patterson, a 6th grade student. Fifth place was McKenna Johnston, Highland Junior High, 7th grade student. Sixth place was Trig Jackson, an 8th grader at Greenfield Junior High. Seventh place was Trenton Hales, a junior or an 8th grader at Desert Ridge Junior High. And 8th place was Mason Smith, and Mason is a 5th grader at Neely Traditional. So congratulations to, and let's give them a hand, to all of our spelling bee winners. Next, congratulations to Caitlin Blackburn, a Campo Verde student who received the Lanny Williams Award for Student Athletic Training Aids. This award is given to the top 3 students in Arizona for their work in sports medicine. Congratulations to Caitlin. Next, we have congratulations to Ty Thompson. Ty is a Mesquite High School student. He's a senior who received the 2020 Ed Daughtry Award. For 34 years, the Ed Daughtry Award has been one of Arizona's highest individual high school football honors and is awarded annually to the state's most outstanding high school football player. So congratulations to Ty. He's going on to I think he's going to Oregon to play quarterback there and represent not just Mesquite High, but Gilbert Public Schools. So congratulations to Ty. We'd also like to acknowledge and thank the generosity of the community. Gilbert Public Schools was selected to be the recipient of the 2020 Barnes & Noble Holiday Book Drive. As a result of the book drive, the Barnes & Noble bookstore located at Santan Village received approximately 899 books for our students. We look forward to distributing them district-wide to our students and staff, and we appreciate Barnes & Noble for their thoughtfulness and support of our community. So thank you, Barnes & Noble. And last, these are winners of the innovation grants. These are our staff members from the Gilbert Education Foundation. This is funded by those who contributed to the Power of One campaign. So thank you for everyone who contributed. From Sonoma Ranch, teacher Tasha Cermelli for a herb and spice garden. Desert Ridge High School teacher Robert LaPlante for an esports lab. Town Meadows teacher Laura Furnell for nonfiction library update. Gilbert Elementary Louise Heeman for Reaching Zen Project. Superstition Springs Elementary Carrie Norton for a Radical Robots Project. Playa del Rey Elementary Carrie Lenko for Artfully Me Project. Desert Ridge Junior High Patty Kentiel for a new STEM class. Gilbert Classical Academy Nicoletta Alfaro for a GCA Wellness Center. Gilbert Classical Academy Judy Engel for a Vitamix Nutritional Cooking Project. Patterson Elementary Heather Alfrey for Calm and Connected Campus through Mobile Mindfulness. Carol Ray Ranch Elementary Addie Lafferty Beakley for Project Spicing Up Learning for students with autism. Sonoma Ranch Elementary Patty Munley for Sonoma Student Podcast, Building Community with Technology at the Ranch. Gilbert Elementary Scott Frankham for a Microscopically Speaking Project. Gilbert Classical Academy Pierre O'Brien for an outdoor wellness area. Mesquite Junior High Haley Mercy for a STEM and Sports, a golf unit. South Valley Junior High Linda Levy Music with Technology Project. Gilbert Elementary Anna Parra for Where in the World Will I Go Project. Gilbert High School Alba Alvarez Stewart to create The Giving Closet. And last but not least, Gilbert Elementary Maribel Medina for dual language Spanish books. Congratulations to all of our innovation grant winners. We look forward to seeing all the great things you do with those grants and how they impact our students. Please give them a hand. Dr. Santa Cruz, that concludes my recognitions for this evening.
Thank you, Dr. McCord. We'll now move to item 5, request to speak to the governing board. We have 5 requests this evening. Could we please go ahead and play the recorded message?
The superintendent's
We have a
report.
superintendent's
I'm
report.
ahead of myself.
All right, I know.
Dr. McCord, I apologize. Superintendent's report.
All right, this won't be long. Just yesterday, we sent an email to parents and staff about returning to full-time in-person learning on Monday for February 1st. We appreciate all the time and effort everyone has put into hybrid learning. While transitioning back to full-time in-person learning, it's important to remember to adhere to all the mitigation strategies we have in place to create the safest learning environment possible. Our teachers and support staff have done an incredible job educating our children. In order for that level of learning to continue, we have to be responsible for our individual actions to help stop the spread of COVID-19. A huge thank you to our families for everything they have done to support their children, our staff, and our district. Being in hybrid is no easy task for our students and families, and I sincerely appreciate all of your efforts. Even though our schools will be fully open on February 1st, we still need to wear masks, we need to wash our hands, and we have to social distance when possible. Please take care of yourself and those around you. We live, work, and learn in an exceptional community filled with amazing people. Over the past 10 months, COVID-19 has put a strain on our community and countless communities worldwide. We often talk about the seriousness of the virus, what the virus can do to someone's health, but it also has done damage to relationships. As we continue to navigate the rest of the school year, please remember, at the end of the day, kindness should always win. Mother Teresa is quoted as saying, "Kind words can be short and easy to speak, but their echoes are truly endless." Dr. Santa Cruz, that concludes my report for this evening.
Thank you, Dr. McCorden. Once again, I apologize for skipping over that. Item 5 is a request to speak to the governing board. As I indicated, we have 5 who wish to address the board. Could we please go ahead with the recorded message?
The board may make an open call to the public during a public meeting, subject to reasonable time, place, and manner restrictions to allow individuals to address the public body on an issue within the jurisdiction of the public body. At the conclusion of the open call to the public, individual board members may respond to criticism made by those who have addressed the board, may ask the staff to review a matter, or may ask a matter to be put on a future agenda. However, members of the board shall not discuss or take legal action on matters raised during the open call to the public unless the matters are properly noticed for discussion and legal action. During the open call, the board requests that speakers refrain from voicing complaints against school personnel or any person connected with the district, as it may impact due process rights. Policy KE, KEB, and KED are provided by the board for disposition of legitimate complaints, including those involving individuals. Forms required for use of these policies can be obtained from the Gilbert Public Schools website.
Speakers will address the board in the following order: Jessica Wick, Sophia Young, Karen Otero Fisher, Steve LeSueur, and Jake Given. Please approach the microphone. You have 3 minutes.
Go ahead. I'm sorry. Dr. McCord, I came here today as a frustrated parent, and your speech made me step back and think a little bit more on how I was going to approach and state my case to this board. But I still feel very strongly about what I'm going to talk about today, as my frustrations continue as a working parent. And I am concerned that the decision to continue with a in-person model will again be brought to the board, and we will go back and forth between a hybrid and an in-person, which is my biggest fear for my children. What would the members of the board and the teachers and the support staff of our schools' response be if the rest of the community took the same actions you are? As a healthcare professional, the clinic I work at continues to this day to struggle to find disinfectants, gloves, and face masks. Did we close? Did we refuse to give care or offer limited hours? No, we became creative. We switched cleaning solutions. No Clorox wipes? Well, they make us spray. Hand sanitizer is a convenience. We have plenty of soap and water to wash our hands. Masks are required in our clinic. If you don't wear it or you pull it down repeatedly, we will ask you to leave. Grocery stores, home improvement stores, and restaurants are open and serving their customers. What would you say if you went to go get a gallon of milk and the store was closed with a sign that read, "Not all of our employees have gotten their vaccine yet. Please return when that happens." I have a 4th grader and a 1st grader. As of today, they have attended 26 days of online learning and 63 days of in-person learning. My children have had 17 days of at-home learning with paper packets, copied pages of workbooks. Some of the material in the packets they swear they haven't learned. When I do fractions, 2/4 is actually 1/2. I taught my 4th grader that because at 7 p.m. at night when I get home, I am now the teacher, and that's how I learn math. I'm requesting this board to consider moving spring break to the same week as spring holiday, which will give our children 2.5 days back of in-person learning to recoup some of the time lost to paper packets. I further request considering discontinuation of early release days. There are 15 of these left on the current calendar, and discontinuation of the 3 remaining half-days allotted on the calendar. This will give our children approximately 24 hours back for teacher instruction. We have all made concessions, sacrifices, and modifications. The difference is I am still serving my patients. I am doing my job. There are consequences when you do not do your job. You lose vacation time, you lose pay. State funding is diminished because parents finally come together to question why logging
Time.
in.
Hello, I'm here to give a perspective on the decision that was made for in-person and online learning, a perspective from a student that I feel was not heard. Ever since I was a child, I was terrified of going to school. Not only were we reminded every day that there was a possibility someone could come in with a weapon and harm us, we were also faced with the society where we were afraid to be different. Ever since I was 9, I would go home crying every day, ranting about my mistreatment by my peers, as well as the unconsensual sexual acts forced on me as a child. Every time, I would run into my mother's arms, and every time she inspired me to want to try to live a little longer. My mother is a very sickly woman. She has Hashimoto's thyroid disease, as well as arthritis and more medical conditions I can't even begin to pronounce. In my freshman year, the warm arms I used to run into felt colder and colder, as she got sicker and sicker, and every night with tears in my eyes, I would think about what I would do if I lost my mother. I lived 10 years of my life terrified, but all the terror I felt as a child does not compare to the terror that I feel today. My dad is a medical worker. At the beginning of the pandemic, he worked in the front lines with confirmed coronavirus patients. Every day he would come home more and more tired. And even after removing his mask that was under his face shield, he could not run into the arms of his wife and children, as the fear of getting his wife sick and watching her die like he watched his own patients was too big for him. Every day, I live in fear that when I go to work and come back home, I bring back something that was not worth the money. And I'm sorry that some parents fear for their children's grades, but I fear that I may become an accomplice to my mother's murder, and that the arms I ran into when I felt like I could no longer put in the effort will be gone. I've never felt like student lives or opinions have mattered to the government or school boards. Every day I feel like we are used as political agendas that are used to push, we're used as pawns to push a political agenda. All I ask today is that when you consider your decision that was made, to take into account the thousands of people who have died without needing to, and the people who could die with today, just like my mother. And I hope that the decision to protect some children's grades that some parents claim was worth the sacrifice, I hope that it was worth it to them, because the day my mother dies is the day that I die with her. That's all I have.
Can you state your name? We need it for the record.
Sophia Young.
Thank you, Sophia.
Go right ahead.
Hello, my name is Karen Otero Fisher. I am a health data analyst with previous experience as an epidemiologist. My best thing right now is I'm a mother to a daughter at one of your schools. I want to tell you what happened at her school last month. In the 14 days that you actually had virtual and hybrid learning, we got notifications of 4 different exposures. When I looked at the average time frame between the exposure to when I was notified, it was an average of 6.5 days. As an epidemiologist, that is atrocious, knowing that there's a 2-week infection period. I know that your current metric is to use a 1% or 2% based on the population at hand. And seeing what I saw, I would say that you're about 6.5 days behind when you actually have a pandemic. That is all I have to say.
Thank you. Stephen LeSueur?
All right, thank you so much for all that you guys do and for the opportunity to be here with you guys today. In light of the times that we are in, I'm grateful for the year 2020. We have all been through a very interesting time. What I have learned is that you cannot live in a community and not offer meaningful service to the community. In light of what we have been through with our kids being out of school for nearly a full year now with struggling education, we as citizens of Gilbert can no longer sit around and be frustrated, but we must stand up and make a change where change is needed. I do feel that the time has come that some of you on the board have been involved for too long with making decisions for our kids and are no longer representing the majority of families and teachers that live in Gilbert. I've grown up in Gilbert since I was 12 years old. I love our school system, and I am grateful for the many amazing teachers that teach at our schools and affect my kids' lives for the good. I know that the majority that are involved in our school system are amazing. I experienced that when I was in school. It is time that some new minds get involved to help our school system operate and function at a level that we all want that live in Gilbert. Too many people have left the school district and are planning to leave the school district next year. If any of you on the board are feeling run down after this year and you are unable to make decisions for the majority, I call politely for your immediate resignation. I also call on all people that live in Gilbert that have the ability to step up in positions like this to get involved and make a difference. I will be running for Gilbert Public Schools Board in 2022, and I encourage others to do the same. We are woke as a community of loving parents who demand the best for our kids. Thank you.
Jake Given.
Hello, my name is Jacob Given. I manage a data science team at Amazon. And what I want to talk to you about today was the metrics that we've chosen to use to decide if we should be sending our kids back to school. So we've all know the metrics at the Arizona health level, which were currently still red. But the metrics that we've chosen to use in Gilbert is percent of active cases in a school. Well, at our current level of prevalence in the state of Utah, or sorry, state of Arizona, Utah's the same way right now, in our current level of prevalence, active cases is more than just the cases that you know about. The University of Georgia has published a website where you can track, based on your state and your zip code, of how many known active cases there are, and what the percentage is of any given event, of the percent of people at that event that have COVID. In my kid's school of GCA, with 500 students, with a current level of prevalence in Arizona, there is over 60 kids that have COVID. Now, you say that we're going to use 1%, that's fine, but active cases are more than just what you know about. Since my kids have been going back to school, we've received a letter, just like this other lady has, 3 letters stating that my kids were exposed to COVID. And that's just the ones that you know about. I personally know, or my wife and I personally know, of people who got COVID as adults, sent their kids to school anyway, did not get their kids tested because they didn't want their kids to miss school, even though one or both of the parents got COVID. The most dangerous thing my kid does every day, my kids do every day, is go to school. And our new elected president said that in order for us to fully reopen schools, we need to test. There are school districts in this country that mandate their kids get tested every month. it's a requirement. I don't think that's too hard to ask if we're going to go back to full in-person learning to mandate that our students get tested. If you asked me to do it, we would do it. I think it's not too much to ask. So like these other people here that say that they're looking at possibly going somewhere else, so is my wife and our family. We're looking at going to a state, going to the location that values protecting our families, protecting our kids, and making sure that they can learn in an environment free from not just external factors of violence, but also from each other. Because every time that I go down to downtown Gilbert, I drive through downtown Gilbert, I go to the store, I see people that choose not to wear masks, choose to, hang out in large groups, and those are people that we want to avoid. So I would encourage you to keep us in hybrid. Just because you don't know of an active case, the data tells us that we actually do have them. And until our case count goes down, we should remain in that mode of learning. Thanks.
Thank you. That was our last speaker. We'll move to item 6.
Dr. Santa Cruz?
Yes.
Could I just mention that we also received many online
Yes.
inputs, and just want to acknowledge that we have received those, we've read them, and we appreciate the people who input those before noon today, and then as well as the emails that we received. Is that okay to
No, I
acknowledge
think
that?
that's perfect. We had 92 submittals. Those are online for anybody that wants to view them. They're public record. Just go to our website under the governing board section, and you'll see a comment section that you can look at each one of those. And thank you to our communications department for making sure that's all set up and managed well. So thank you.
And that's going to continue, correct?
That will continue, yes.
Thank you, Ms. Wood, for reminding me of that, and thank you, Dr. McCord, for addressing that. Item 6.01 is COVID metrics and pod update. Dr. McCord?
Thank you, Dr. Santa Cruz, governing board members. While I'm hooking up to our WIDI, I would like to also, I had a principal send me a message saying that I screwed up something in the recognition, so I want to correct that right now. Sixth place was McKenna Johnston. She's from Carroll Ray, not Highland Junior High. So McKenna, I sincerely apologize. Ms. Hanson, thank you for letting me know that. Okay. As we've done in previous board meetings, I just want to give you an update on the benchmarks and also add a pod update, which is a pointed distribution update. Heading to our Maricopa County data, this is as of reported on January 21st for the week of January 3rd. For criteria 1 case rate, it's 939 per 100,000. That's in the red, and that's trending up. For criteria 2, percent positivity, that's 22.7%. That is red. That is trending down slightly. And for criteria 3, hospital visits, that's 18%, and that is in the red, and that is trending up. And for Gilbert Public Schools specific data, reported on, I'm sorry, this should be the 21st. Case rate is 990.31 per 100,000. That's red, trending up. Criteria 2, percent positivity is 25.35%. That is trending up as well, and that's red. And criteria 3 is 13.7%. That's red, and that's slightly trending down. So those are the two areas that we've looked at. And this is just a side-by-side comparison of Maricopa County and Gilbert Public Schools boundaries. And then again, this is over the last 4 weeks as reported. I don't need to go through each one of them, but It's available, and this will be available online tomorrow morning. And for GPS boundaries. Next, just wanted to give you some information based on cases to date for January 2021. If you look starting on the 8th, and that's where we have reported, we had 12 cases, and as we have moved through, you'll see the line going up and down as we go through, and I imagine those trends will continue as we move through the next few weeks at least.
Dr. McCord, when you say cases to date, that's within our boundaries.
Within our
schools.
boundaries, correct. Gilbert Public Schools, thank you for clarifying that. Our highest number so far was on the 15th with 108 reported cases. And again, within our boundaries, and that's to our school district, not just in general.
It's our actual school district, not people outside.
Right.
Okay.
Correct.
I have just a question about how, and I know that we follow the guidelines that were given by the Arizona Department of Health, but there are times that cases don't get necessarily reported on here. Can you explain that, please?
It depends on when those individuals have been on campus and exposed. I'll have Jennifer come up to do the specifics because she does this every minute of the day.
So with the epidemiology's help from Maricopa County, they've explained to us that within 48 hours of being on campus, so the person is either symptomatic or they have a test collection, and 48 hours prior to that, they consider that their infectious period. So we go back those few days. If a person was on Christmas break, then they weren't on campus. If they were on vacation, if for some reason they didn't, on hybrid, if they attended school, the last time they were in school was Thursday, but their first symptoms were on the following Tuesday. Again, they weren't on campus within 48 hours. So then there was no exposure during campus time.
So these numbers could be higher?
Yes. I believe when I looked at it, we had an additional, don't quote me, 83 cases between January 4th when we came back and now that would have not been reported due to that 48 hours. The 50 of those were students and the remainder were staff. So, and a lot of those were Christmas break.
So they wouldn't have exposed anybody on campus. Basically, they are not part of. We don't send a letter home because they haven't been in class to expose, according to what the Maricopa County Health and others have given us.
Mm-hmm.
And
Correct.
so by not including them, basically we're just, what we're looking at is what exposures have we had on our campuses.
Correct.
And then what transmission possibly has happened on our campuses. That's what we're trying to track because that's what we can control and mitigate for.
Correct.
So, Dr. Santa Cruz, if I may, so Ms. Frost, so just trying to understand the full gamut here. So if a student has COVID but was not on campus at a time within the 48 hours of symptom or thereafter when they were contagious, are we understating the risk within the school community by not including them in the dashboard?
You know, I don't believe so. These are not things that we came up with. These are not our guidelines. These are guidelines straight from Department of Health, from their epidemiologists. This is how they work cases that are out in the community as well. So if I was to be positive for COVID and the county would call me, they would ask me to go back 48 hours prior to my symptoms or to when the test was collected to look at when I could have possibly come in contact with people and then infected them. So I feel that that's an appropriate approach to use on the school campus as well. We do find people that show up symptomatic in school and they report it or have been in school within that 48 hours and we report those as well. Our goal is to make sure that when we are communicating with parents and staff that there's a positive case, that matches what we're looking at on the dashboard as well, so that they can see that we're reporting to them what is actually happening on campus.
Anything else?
So not necessarily from Ms. Frost, but she may chime in. So if we look at the impact of COVID within the school system, if we have a student who is not on campus, becomes symptomatic, never, hopefully because they're following the guidelines and not reporting to school because they're having symptoms. So they've never exposed anybody else. How do we measure within our school system how many kids are not in class, not necessarily exposure? As we talk about delivery method and impact and so on, if I look, I've got kids who are active, and we're on campus that are now no longer on campus. I've got kids who may have the COVID, but were never on campus, but are now missing school for 10 to 14 days. I've got kids that we've asked to quarantine. Do we have a way of measuring how many kids are actually affected and not in class because of the cases that are in the system, even if they weren't exposed?
Early on we had a way that we would mark attendance so that we knew who was out because of actual positive COVID case or because they were being quarantined. But it became problematic because then it felt like students were being marked in a way. And so we went back to the regular way we did attendance, which is everybody is sick, excused, or unexcused. I believe on campuses they probably have their own way of tracking it, and it probably would take a little while.
Again, I'm just trying to understand the impact of how many kids are missing school. If we've had this discussion before.
Right.
This is not the first time we've asked similar questions.
Anecdotally, we also have students that are out because their parents are positive. So we do have parents calling school saying, I'm sorry, we can't send our kids to school because my wife and I am positive. And they've been very upfront about it and very good about the quarantine process itself. Also, just to note, any students that are, just because they're not considered on the dashboard because they weren't infectious on campus, we still follow up with them. So they're still following their isolation protocols. They're still out for 10 days. The nurse is still giving them guidelines for that. So they're still out of school. They just weren't necessarily reported on the dashboard because their infectious period was not while they were on campus. So they're still, our hand is still in it as far as that process. We're still helping them with school online or via emails, things like that with their teachers. It's just the reporting process is different.
And right now, I'm changing a little bit topics. Right now, our policy as per the county and the state is that they can return after 5 days, 6 days with a negative test?
That's quarantine.
Quarantine, yes.
Right,
yes.
That's quarantine. They can return on the 8th day if they have a negative test on the 6th day.
Okay.
So isolation is when you actually have COVID yourself, and then quarantine is if you've been exposed.
And some of our neighboring states have, as of December, have actually done away with the quarantine for exposed students. Is that not correct?
So JAMA, the Journal of American Medicine, and the CDC have found a very low spread within campuses. So some states have opted to not quarantine due to campus exposure.
And I'm just asking these questions. I'm not necessarily going anywhere. I'm just trying to make sure we're aware of all the information and make sure that the public is aware.
That information came out prior to Christmas. I did ask our county partners about that. At that point, they weren't ready to change that guidance. And then, of course, our community numbers went, through the roof. So it was poor timing. I believe that if our community was on board personally and socially, and our numbers were low, that would be possibly a great idea so that students wouldn't have to quarantine. But with the numbers like this in the community, I don't know that we would ever get that guidance changed.
Now, to clarify, the 2 states that I'm aware of that have made those changes, that is specific to exposure at schools.
Correct.
And it is also specific if they can demonstrate that both the person with the case and the person exposed were both wearing masks, then they waive the quarantine. So it's not a blanket waive of the quarantine.
Right.
It's a situational.
Correct.
Anyone else? Ms. Humphrey?
I do have one question for Ms. Frost. I know we've done a lot of the contact tracing, and we've had students out quarantining because they have been exposed. Have we seen those students coming down with COVID, or has that been a more rare exception?
That's been the exception, not the rule, correct?
Okay, thank you.
I had one question, actually two. One would be to follow up to, you said there were 80 cases that have not, or so that have not been reported, 50 of which were students, 30 or around about.
Yeah, I have the numbers.
Would you say a majority of those were over the Christmas break and then spilled into the school year, basically?
Yes.
Because that makes sense if they got it over, especially when the numbers have been so high.
Correct. The majority of them, I would say 90% of them were because of
Over
Christmas
the break and just didn't ever come back to school because of that.
Right.
Okay.
And also some of them also could be like on the hybrid days too, correct?
Yeah, and that's, now that the Christmas break is further in the background, that is what we're seeing now, is every once in a while I have somebody that was on hybrid, and that's why it's not reported or reportable.
Then my second question is there any way that we can, as mentioned by one of the parents tonight, is there anything that we can do to shorten the time that we send out a notice to parents from when we receive the information? Or what's the process? Are we as timely as we can be on that? And it's just because we haven't heard from the the county or the parents, or what is the process? And can we do anything?
We send the notice out the day we are informed. So a lot of the delay has to do with either the testing results, because we're seeing, when the cases go up, test results take longer. So we have people that are taking 4, 5, 6 days to test. Some people don't test the day they have symptoms either. So they may have symptoms and then wait 3 to 4 days before. So we know their last day was Wednesday. They test Saturday.
And you wait to send it out on Monday because you've got the positive test on Monday.
We can't report anything until we know the test is positive.
Okay.
I've had several administrators ask me, well, this child had, 3 symptoms. Can't we just please send a letter out to the classroom and say this child was sick? And I said, we can't. If we don't know it's COVID, we can't send out letters. In fact, county did not approve of the idea of us sending the general classroom exposure letters because of this same idea, because parents are getting letter after letter and it's general. So it might have been a para that came into a classroom for 10 minutes. And we report that because we want to make sure that we're being as clear and as transparent as possible. So my personal belief is then that brings the anxiety up. So as parents get 3 and 4 notices, they in their heads feel like, oh my goodness, it must be that 3 or 4 people in my child's classroom that they sit with have this, but that's not necessarily the case. But we are reporting every single possible instance, and an exposure is different than a close contact. So close contact is within 6 feet for 15 minutes. An exposure is just an exposure. It could be somebody that was, in the room for 10 minutes. It could be, a student that sat on the complete opposite end of the classroom. But we're trying to be very diligent to make sure that there's nothing that we're hiding about that.
Thanks. And thank you to your nurses and everyone trying to work through this.
Amazing. My hope, my wish is that Nurses Week this week will be something huge for them because they have done it all. They're amazing.
Yeah. Thank you.
Well, and I really appreciate that we can have nurses at every school.
Yes.
That's a huge thing that Gilbert has done, and I really appreciate that. I did have one more question. Because we have all these mitigation strategies because of COVID, has that also cut down on the other illnesses that we usually see? Flu, colds, that kind of thing.
What's interesting is before break, we were seeing kids that were symptomatic of a respiratory illness. And the majority of children that got tested in the elementary system were not COVID. It was your average cold or whatever. It's the upper classes, the high school and the junior, well, more the high school, that had more issues with it. But the kids that went home in elementary school, the ones that chose to test, which were quite a few, I would say more than half, they were not COVID. So overall, are things down? Yes, yes. But unfortunately, I don't know how many practitioners are testing for the flu right now.
Okay.
So it's hard to tell.
All right, thank you.
Can I ask one more question? Ms. Frost, some of our neighboring states are doing a tests in the school. So if they see a certain number of cases at a given school, the state is actually stepping in at the request of the school, but what the state will step in and do what they're calling it, at least one state, a test to attend. So they can come in, if they're rapid test, if they're negative, they can attend. If they are positive or the parents choose not to, then they're asked to quarantine for 14 days before returning because of the outbreak at that school. Has our state or county talked about doing anything or offering any kind of service like that?
No, the only offer they had was an offer for rapid tests that they would supply to us. But the burden of being able to process and use those tests was so high. We had to agree to report everything to county and the state. We had to collect the test, which if any of you have ever tried to use a Q-tip and put it up a child's nose, usually takes more than one person. And so we don't have staff for that. We would need several extra people in each health office in order to use those. And included in that, all those things, we also had to agree to test for flu as well. And so the burden of using those was much higher than what the positives would be. That was the only offer they had for schools as far as that went.
Mr. Carr, I think some states actually funded that,
Yeah.
which makes a whole difference because, when we don't have the funding.
No, and that was my question,
Yeah.
as the state or county considered doing that. And the state that I'm aware that's doing that I've been reading and following, it is the State Department of Health will come in and
Right.
facilitate that at the state's expense when there's an outbreak at a school. And they're defining, by the way, an outbreak is 1% active cases, defining active cases the exact same way that we are.
That's interesting. Good.
Anything else?
Stay close.
Okay. I'm not going to look.
All right, I'll move on. Just to let you know where we're at, total confirmed COVID cases since September 10th, 2020, students is 873, staff is 253, and total is 1,126. Just to let you know, as we talked about the dashboard is updated every Monday through Friday, usually before 9 a.m. They include reported current active cases and resolved cases for each campus. Going back, we will use the cases reported each Wednesday to determine if any schools will need to return to hybrid the following Monday, and that would last for 2 weeks. And that's using the percentages listed here, 1% for high school, 1.5% for junior high, 2% for elementary, at Canyon Valley, 5 active cases, and at Rise Junior High, 3 active cases.
Dr. McCord, just remind me, I think most of those numbers, especially for elementary and junior high, even though elementary seems that much higher, it's like less than 10 cases at most of our elementary
That is correct.
schools.
You're looking between probably 7 and 12, I mean, the breadth of them.
For any elementary,
Correct,
depending
in
on the
elementary.
size.
That is correct.
All right, thank you.
You bet. Next, I'd just like to give you a quick update for our point of distribution, our pod update for vaccines. At the beginning of this, and when we heard a vaccine was coming out, Mrs. Frost and myself had made contacts stating that we'd be very, very willing to host one of these. And as you've seen, some have been able to host, while others are still waiting. And we finally got our date, and we will be holding a pod Saturday, February 13th and Sunday, February 14th from 9 a.m. to 5 p.m. at Highland High School. We'll be partnering with Higley Unified School District and Queen Creek School District. We also have to offer it to other charter schools, private schools, and daycare centers within our area. What happens with this is we work with a pharmacy. We get partnered with a pharmacy, and that's Albertsons Safeway Pharmacy. they'll be supplying the vaccine and doing the vaccinations. On Friday, February 5th, they will share with us the link to sign up. And then once we receive that, we will share it with all of our staff. And again, this is as updated as information as we can get, which was yesterday afternoon, I believe, right, Mrs. Frost? And so if we have anything more pertinent, we will definitely be putting it out to our staff and letting them know. Mesa Public Schools has theirs going on, and they had several available slots, and so it was opened up to us in Gilbert Public Schools for those schools that and departments that resided within Mesa city boundaries. So we've had employees go to their location and be vaccinated, so we're thankful for that as well. And I think that's a good point, that this is not about one community or one school district. This is about all of us, and so partnering with these other school districts is a very good thing, and opening up to those others in our communities for the 1A and 1B areas. And so we're just very thankful that we're going to have this opportunity, and we'll make sure our staff knows exactly what to do when the time comes.
May I make an observation on this? We were able to sign up through Chandler Gilbert's number of staff members, and trying to get on the website has been a nightmare. I know a number of teachers that have gone to Chandler Gilbert and gotten their first vaccine, and I personally got an email from the Arizona Department of Health telling me to go for my second one. And so I have the, I guess I want to say, the luxury of being able to go online every hour on the hour all day long. And there are no vaccines as of right now. And so I think that's the concern I have. This is a wonderful opportunity as long as somebody hasn't gotten the shot already or their vaccine, because you can't mix the different kinds of vaccine. And Chandler Gilbert was, I believe, is Pfizer, and as is State Farm is Pfizer. And I think the school districts are doing Moderna. Is that correct?
That is correct.
So I think this is absolutely wonderful, and I'm really pleased that we're able to do it. It's just that there's a number of our staff members who are getting stuck in this next category of not being able to get their second one in a timely manner. I ended up actually talking to somebody yesterday after I waited on the phone for 45 minutes. And basically what I was told by the person at the Arizona Department of Health is that there are no second vaccines right now. I have no idea how true that is. I would assume that somebody that answers the phone there knows what they're talking about. So I think, that's a concern I have, is that she also said that the efficacy is around 50 to 55% for the first one, for the Pfizer. And I'm assuming it's the Pfizer. I didn't pursue that. So, I think that's a frustration that a lot of people I'm hearing are having, is not being able to, they did everything right. They got the first one, and now they can't get the second one. And I know that's not your fault at all. You guys are doing.
Why not everything else?
Yeah, I
it's
know.
all right.
But, and this is a wonderful opportunity. Do we know, though, that this is the first one for a lot of people? This might be their first one with this opportunity. Do you know what the second one is
Yeah,
going to be?
I think it's in the middle of March, I think, if I remember reading your memo.
So teachers basically or staff members are having to wait possibly up to 2 months to be fully vaccinated.
Depending on where you've gone. And
I believe the Moderna, though, after the first vaccination, is above 90%.
92%.
After the first one?
Mhm.
Yeah.
And the second one is 95%, so that will help
Wow.
some of that. Ms. Frost, can you give us any updates about the second vaccinations and what you are doing as a school district and nurses and trying to help our teachers?
So we actually have been putting out communications. Our communications department has been great about updating our employee hub and our health services page with some tips that we found from Maricopa about if you have not been able to get a second dose, here's a link you can go to fill out a survey. They wanted to kind of get a gauge on exactly how many people were waiting. We also gave them information from Dr. Kara Christ that she had put out about how for the second dose, they don't want you to get the second dose any earlier than 4 days before it's due. But there is no change in efficacy if you get it at 30 days, 40 days, 50 days. At this point, they are saying that it is no change in how much your coverage is if you don't get your dose on time, or even 20 to 30 or 40 days after that. So I know there's a lot of anxiety around getting that second dose. GCU did open up a site today, and we put that out to the employees as well. So I think as time goes on, more sites will open up. But we just have to be patient, and we've put out every bit of information that we could to our employees so that they would have that as well.
I don't know if you can answer this question or not, but maybe it would help. Is it an absolute that you cannot mix the dose, the two different ones?
So from the Department of Health, it is not an absolute. It is not recommended, but quote unquote, you will not grow another head if you mix the doses.
So let's just say hypothetically that you have staff members that got their first one and cannot get the second one by this date, and they got Pfizer. Could they possibly get the Moderna without? I don't know if you can even answer that question.
I wouldn't answer that question
Okay.
for the mere fact that if something goes wrong and someone said they heard it here.
I'll call the Arizona Department of Health.
Yeah, I think that's.
Well, it's not clinically appropriate, no.
Okay.
I did have a couple more questions.
Go ahead, Ms. Humphrey.
On the 13th and 14th, do we have hours? Is this going to be around the clock? What is the?
It's from 9
a.m.
to
to
5.
5 p.m.
Okay, that's what I was thinking.
No
Okay,
way.
and then we have a planned event in March that they can then come back for their second dose.
Correct, for the follow-up, yep.
Okay, all right, thank you very much.
And then
Yeah.
finally, sorry, so this again is for 1A and 1B, those people who qualify for 1A and 1B, which includes our
It's just our
teachers.
employees. Did I misspeak there?
Well, it could be for 1A if you're talking if it's a school nurse, but it's any school employees, and the way that they have worded it is any person who is important to the operations of the school. So everybody that works for the school, charter, private, and then as well any daycare providers or child care centers.
Okay. And I just want to say how great and amazing it is that we have prioritized teachers and everybody that works, because I know people who are not in 1B yet and who are wanting to get the vaccine and aren't even able to get it yet. And so I am excited that even though we're waiting and we're trying our best and it's urgent, so urgent that we're able to get these vaccines to those who want it. And I know that many teachers have gone after it and really worked hard to get it. I appreciate them. But I'm also thankful that we can have it and that they have those opportunities and that they've made that available to our teachers, knowing how important it is for our students and teachers to be in school. So thank you.
We'll be looking for volunteers as we get closer to that. And we also may be looking for schools or families to donate. We're going to have like 15 pop-up tents that we need to have out there. So it really will be a community effort, and we'll be putting out information as some of those needs come up.
Dr. Sanders, if I can
Go
just, my questions have been answered, but I just want to comment. Dr. McCord, I think you slightly downplayed the effort that Ms. Frost and the district has taken to get this pod. I know that I've been asking outside of the board meeting for, it seems like, 5 or 6 weeks, can we get our own pod? Can we get our own pod? And I know that Ms. Frost, from day one, the first time I asked this, we already have an application in. We followed up. We're waiting to hear back. To teachers and staff, please know, I know that Ms. Frost is frustrated that we're as excited as we are, and as much as I want to say thank you to the county and thank you to Ms. Frost and her staff for organizing this and getting it going. I also want our staff and teachers to know that this has taken longer than any of us would have wished, and certainly Ms. Frost would have wished. We would have liked to have offered this the very first day that it was open to teachers, but we're working through the system, and I just personally want to say thank you for all your efforts to get this in place.
Dr. Santa Cruz, can I ask one more
Yes.
question? Would there be later on then, would we continue to offer pods as it goes down to 1C and then to the community? Or how, do you know how that will be rolled out later on? Is that going to be through pharmacies and just at the pharmacy? Or do you know?
I don't know. I don't believe that we would be asked as a school district to be providing any for the other categories.
Okay.
But, there's been a lot of unanswered questions about a lot of things, so.
Okay, thank you.
Never know.
That concludes my report.
Thank you, Dr. McCord, and if the board will indulge me, I would like to express a point of personal privilege. I think it's consistent with the discussion we've been having. And as I read my statement, I want to make it very clear that I do not speak for the board. I am speaking for myself as a board member. COVID-19 has caused us all to remain constantly vigilant about the threat that this illness presents to all segments of our community. I believe that we have all come to realize that there are no right answers. The best we have is our ability to assess the data, review a myriad of reports, consider the ramifications of our decisions, and proceed in accordance to our best judgment, given the information each of us as individuals has analyzed and reviewed for him or herself. Given all of the information that is available, I submit that we are confronted with conflicting, difficult decisions. These occur because the data and the information received are also conflicting and inconclusive in many circumstances. As we seek a right answer, we are left with the results that provides us with a momentary best course of action. If there is a right answer, I will happily embrace it. I will respect the will of the majority vote on our last meeting. I must, however, express my opposition to our implementation of in-person instruction beginning February 1st, 2021. My assessment of the data and the information at this point in time leads me to conclude that this action is premature. I do this with the understanding that many can express positions and present evidence contrary to my position, and we may both be correct. The best we can do is resolve to continue to confront the current situation regarding COVID-19 with a renewed commitment to reinforce and consistently implement all of the mitigation strategies we have organized and put in place to attempt to safeguard the health, safety, and welfare of our students, faculty, and staff. These strategies may be little consolation to some of our frontline professionals and employees. We truly understand, or I truly understand, the concern and trepidation, but resolve to continue to do what I or we can for all who work in and attend our schools. Again, the right answer remains elusive, and all of us are anxious to return to a sense of normalcy. We are inching our way to that eventuality, but the challenge looms ever present, and we are left to contend with the best course of action in the face of many conflicting data points and information and our own interpretation of what is best for our students, faculty, staff, district, and community. Perhaps we will find a correct answer very soon.
Dr. Santa Cruz, may I chime in on that?
Shirley?
would like to say thank you for that. I know you spoke for yourself, but you spoke eloquently, and you mirrored exactly how I feel. It's been a very, very difficult time, and as I said, my greatest concern is that we don't have full vaccinations yet, and I know everybody's worked very hard to try to get it, but it still is something that makes me worried, and I appreciate that you said that. Thank you.
Thank you, Ms. Uggetti. If that's all, Ms. Humphries?
I would just like to add, I appreciate that statement. I think that everyone on this board has struggled with this decision. I mean, for me, it's been a huge struggle to figure out what is the right thing to do for us as a district and our community. And what I'm left with is that school boards and superintendents cannot make up for the lack of federal and state leadership, policy, and action. We shouldn't be making these decisions. They should have been made higher up. But I know that we will each member of the board will press to make sure that mitigation strategies are in place. We'll ask our community to wear their masks, ask our students to be cooperative and wear their masks at school at all times so their teachers will feel better and safer. It's a community effort. We each have an individual responsibility. It is a community effort. The data that we have now doesn't have to be that way. If we each put that effort into following the CDC guidelines, we can make those numbers go down. But it really is, I think, something that needed state action, not just school board action.
Thank you, Ms. Humphries. I make the statement not to create consternation or difficulty, simply to express a point of view. And we have voted. We have put in motion what that vote represents, and we will move forward. Item 6.02 is a monthly budget report. Dr. McCord.
Thank you, Dr. Santa Cruz. Governing board members, we have Ms. Betts tonight with our monthly budget report, and I think she brought along a friend or two to help out with maybe the next report.
Good evening, Dr. Santa Cruz, Dr. McCord, governing board members. This is our combined monthly report as well as the first quarter financial report. So we're going to start, of course, with the monthly report reflective of all the activity through December 31st, 2020. I wanted to share that I do have Ashley Miranda with me tonight to help answer any questions in the event that the board has any. So wanted to begin, there we go. I wanted to bring your attention to the revised budget number 2 pending. Note that we've had an adopted budget. We were required by state statute to revise our budget prior to December 15th, so we had the revised budget number 1. It was really important to be able to make sure that we're updating the board and the staff on how the budget is changing as time goes on, this year in particular. It's a reminder, having that revised budget number 2 pending, that we are funded on current year funding, and this year in particular, our student counts are fluctuating monthly for certain. In addition, the revised budget number 2 pending includes the distance learning adjustment, which is about $6.5 million for Gilbert Public Schools. That was due to an executive order signed by the governor indicating that all students that are learning in a distance learning model would be funded at 95%. So as of the 40th day, we had to present a percentage of distance learning. At the time, ours was about 65%. But I wanted to point out that that $6.5 million reduction is our worst case scenario, because as you move through the year, the denominator continues to grow, which ends up decreasing that percentage over time. So we are expecting that to improve. In addition, looking at the maintenance and operation budget in particular, that's about budget capacity, but I wanted to draw your attention to the year-to-date expended encumbered. In that particular cell, that represents the total utilization of the enrollment stabilization grant, as well as the full amount of the CARES Act 1, which leaves us with that $13.3 million budget balance available. A couple of things. The maintenance and operations budget is very much impacted by the new federal legislation that has been put into motion, so I wanted to remind you about CARES Act 2. We do expect to receive as much as $9 million more in CARES Act 2. That funding source is extraordinarily flexible, so we anticipate that we will be able to reduce that year-to-date expended encumbered number by up to $9 million, again providing us more opportunity to mitigate any budget reductions going into the 2022 school year. Okay. Before I move into the other funds, are there any questions about maintenance and operations on any of that?
So I just have one question. Revised budget number 1 and then revised budget number 2, we went up by about $3 million with that. And what do you attribute that to between those two?
So revised budget number 1 was reflective of data at the time. And we did anticipate the increase in budget balance carry forward associated with the revised AFR. So we did capture that in revised budget number 1. But the primary increase associated with the revised budget number 2 was due to the student count fluctuations. So over a couple of months, we gained about 900 students for funding purposes.
That's quite a fluctuation.
Yeah, it was quite a fluctuation. That was quite a fluctuation. Yeah.
So, thank you. I appreciate it.
So the CARES Acts, you show us those in the grants as well, but they're part of our maintenance and operations.
Only because the spend that was in maintenance and operations was eligible to be moved to the federal grant.
Okay.
So we were allowed to move or journal entry that expense out of maintenance and operations and put it into the federal grants.
Okay, so we'll see it again though on the
You will,
next chart.
yep,
Okay,
yes,
I
you
just want to
will.
make sure. Thank you.
In addition, we've highlighted Civic Center. Civic Center is the fund that we deposit most of our facility rentals. So given the environment with the pandemic, et cetera, you can see that that though we have an available balance of $1.6 million, the revenues received is about $300,000 less than received by first semester a year ago. The indirect cost is another fund because of the National School Lunch Program. We do draw indirect costs from the National School Lunch Program. However, we're able to charge indirect cost against all of our federal grants. So as federal grants increase, we have opportunities there as well. We don't expect the indirect cost revenue, though, to be as high as it was last year. But we'll be watching that particular fund as well. And then finally, I'd like to go back up for a moment to the Maintenance Operations Fund. It shows an available balance of $13.3 million. But I wanted to make sure that you were aware that of that $13.3 million, $10 million has been allocated out to all the departments and schools throughout Gilbert Public Schools. So that means that that money is available to be spent. So wanted to make sure that that was clear. The same thing with unrestricted capital outlay. We are showing an available balance of $8.7 million, but all of that has been allocated out except for about $100,000. So that just wanted to make sure that I was painting the right picture for you as we move through the school year.
So why don't we say that that's encumbered if we've given that to the schools?
Because it's that budget versus encumbrance. So as soon, everything is budgeted and available to spend. And so when it's spent, it gets encumbered through a purchase order. Or when it is used for salaries or benefits, it's encumbered through the payroll system. So we are watching and monitoring that spend and making decisions now about whether we should pull that back and remove it from some of the budgets, but we have not made that decision at this point in time.
Okay, and then just to go along with that, what would be some of the things that the schools spend it on either the maintenance and operations? Is it just daily things, or is it new expenses because of COVID or different things like that?
So the biggest example might be the cleaning supplies, as an example. So custodial supplies with toilet paper, hand sanitizer having to be replaced, soap, all of that. We do encumber for utilities. We did make a decision to leave the makeup air during the summer months be higher than normal, increasing our utility spend. Again, we're halfway through the year, so it's possible that our utility spend will go up, reflective of the June 30 spend. Other items at the schools, they do have supplemental pays that they make to teachers and staff that are doing extra duties. Overtime is considered a budgeted amount that is not ever encumbered because you can't anticipate it necessarily. So it hits the spend portion of that as it occurs. So those are just some items that would reflect that.
And then what about the capital?
So on the capital, as an example, we had planned to go ahead and begin a pilot for our English language adoption this spring. So we are discussing as a leadership team about whether we should delay that as an example. So those are the kinds of things that we're looking at right now to mitigate any decrease in our budget for next year.
Right. Sorry, but just what when you said that it's out to the schools, the unrestricted capital outlay, give me some examples of that.
So let's see. So we made a decision to allocate out monies for lockers as an example for all of our band and orchestra programs at our high school and junior highs. So that money has been allocated out and is available at those schools, but the money has not yet been encumbered because we haven't totally initiated all the purchase orders yet.
Okay.
That would be one example.
Okay.
So this is new instrument lockers.
These are new instrument lockers, yeah.
Which I'm sure they haven't been replaced.
No, they haven't been replaced in a very
20,
long time.
40 years.
And we collected all the data, and bar none, every single school came back and said that that was their most urgent need.
Well, those are expensive instruments that the students are bringing to school. We want to keep them safe.
It's true.
Well, and also, haven't they tried to use them separately and divide it up? And probably we need more than we had in the past.
That's correct as well.
So the opportunity was granted to each of our schools in those two budget lines to increase their capacity by an amount already prescribed by the district for use either in their M&O or their capital lines.
That's correct.
As they have submitted and approved through the district.
That's correct.
This might be a premature question, Ms. Betts. We might want to wait till we get to the CARES Act, but has there been any discussion about any possibilities of a way that we could help with sick days legally, and if we can afford it? And when I say that, I'm talking about when the CARES Act originally had given the 10 extra days.
Well, first, the CARES Act is an eligible funding source to pay for that, and so whether we afford it or whether we can afford it or not is really a decision that would not be mine. It would be a priority decision for you as a board. But again, that's why I wanted to make sure it was clear that we have not even shown the additional CARES Act money that we are expecting. So, and obviously, if the federal government adopts the extension of the FFCRA, we will act accordingly.
Could we have some discussion about that in the future, possibly?
Sure, I'm expecting.
Mr. McIntosh and I and Ms. Betts have been talking about this for the last couple weeks, and we might be able to bring something next week to have a discussion about. But looking at the finances, we got to make sure that our plan is sound. And again, if the federal government comes back and reinstates the FFCRA, then we would be in some different shape. So we got to be careful.
Okay, great.
Go ahead, Ms. Betts.
So this is basically the conversation we just had. just so you're clear. So going into federal grants, which is on the next major financial statement slide or financial table slide, you can see the 3 federal grant funds that are highlighted in yellow. And again, note that the available balance for the ESSER, that which is the CARES Act funding I was describing, which is that roughly $2.36 million, as well as the ESG, which is that enrollment stabilization grant. Remember that we received a total of $14.23 million. We did utilize $12 million of it in the 2020 school year, leaving the $2.3 million or so for this year, and all of that has been spent to date. So we should be receiving the actual cash reflective of those decisions. The reason that we highlighted the other federal projects is because the ESG grant was a part of the other federal projects in the last report. So we've opted to separate those out so it's very clear where we're spending the money. We'll also keep a separate line for ESSER 2 or CARES Act 2 so that it's very clear where that money is and how we're spending it. Are there any questions there?
So we've already completely spent the additional monies from the CARES Act.
That's
the
correct.
first and the ESG. So when will we find out the exact amount for the CARES Act 2?
We should know that. I'm expecting to know that for certain by next week, possibly by the end of this week.
But we still have a lot of other unknowns as far as expenses and
actually budget capacity. What is
budget
our
capacity.
available money?
So
That's correct.
there's a lot of unknown and a lot of expenses on the table right now as we keep moving forward and continue to look forward to next year as well.
That's correct.
Which we'll start talking about next month.
Next month, yes.
Okay. Thank you.
Yep. Okay. So state grants, again, I wanted to point out the Instructional Improvement Fund. So last year, by this time, we had received our first payment. The Instructional Improvement Fund, the source of that is Native American gaming revenues. So we based our $3.1 million budget capacity on carryover plus revenues received last year. We are watching that closely because we do not believe we will see the same amount of revenues this year as we received last year due to the particular decline in gaming throughout the state of Arizona. Adult ed, this was a little bit of a surprise in the current year. We did actually receive 2 separate adult education grants. That's the first time that we've seen over $100,000 in funding for that adult education grant, and those 2 grants total the $119,000, but they're very directed. One's for English language, for adult English language instruction, and I think the other one, which is on my other slide, is just the adult basic education. And then finally, results-based funding. I'm just sharing that to note that last year we received $1.73 million, and this year we've been notified that our allocation will be $1.67 million. We have not received those revenues at all. As soon as we receive them, we will allocate out the entire amount. We expect early March to all those schools that have earned it. Any questions?
Is that just based on last year then?
So the results-based funding is 2 years in arrears, so it's based upon the 2019 spring test results. So going into the 2022 school year, we do not expect to receive results-based funding because there was no testing that occurred in spring of 2020.
Okay, thank you.
Again, I've already shared all of that. This is just a summary for all of you to review. There we go. Enterprise funds. So nutrition services and community school is expected to support their operation through their own revenues. Nutrition services, we do expect their estimated revenues to be decreasing slightly. But community school, the last time we reported, we showed an estimated revenue of $7.5 million. We've done some trend analyses, and determined that we'd like to bring that estimate down to $5 million. So there's a couple of things that are hitting us here. So you can see that their available balance is projected to be $400,000. In speaking with Mr. Ryan and with staff at community school, they are looking at ways in which they can reduce costs and be more efficient. At the same time, they do expect that we did a straight line projection to get to $5 million. As we go back full in person, it's very possible that their revenues will continue to increase. That could improve that available balance. But over the last 2 years, the school district has gained about $700,000 to $750,000 in revenue due to the movement of expense from maintenance and operations into community school for such things as utilities, as an example. As they do their operations, it increases costs. In addition, there's wear and tear on the buildings, all those kinds of things. So with a small balance as that will eliminate our opportunity to do that going into the 2022 school year. So it does have an impact. Even though it's a different fund, it does have an impact on our operational status for our operating funds. Any questions on that? Okay. I don't know where I'm supposed to point that. Maybe it's you. Other district funds, again, unemployment insurance, that's staying pretty stable. We're working really hard to make sure that all of our employees are working and are able to continue to have jobs, and so that's reflective on our unemployment insurance status. And then these are our school student-based funds. So these are areas that the school district has no discretion over. So I really wanted to share, especially these three that are highlighted: auxiliary operations. So that is revenues associated with field trips and with athletics and all those other programs that schools have that they charge a fee for. Extracurricular tax credit are comparable types of activities as the auxiliary operations, and then note the gifts and donations accounts. So at this point in time, so this is 6 months into the year, the auxiliary revenues are down by $1.2 million. That's very significant year over year. The tax credit is down by $1.1 million, and gifts and donations are down $300,000. So you can see that there are other areas in which the COVID pandemic has impacted our school operations.
I have one question about the tax credits. My understanding is the legislature broadened how they could be used a little bit. I know some areas that they were not necessarily Gilbert Public Schools, but because of how strict the rules were prior, it was hard to spend those tax credits. Are we able to facilitate using those tax credits for the reason they were donated and getting those spent?
And all those opportunities are at the school, but if you look at the grid here, you can see that the year-to-date expended encumbered is also still pretty low, and the available balances are pretty high. It's another indicator that our schools are being careful about their spend as well, for purposes of being able to have some flexibility in the future.
Well, and some of those, that they might be saving up for a big trip.
And they could be doing that as well.
Band trip,
That's
London,
correct.
or something like that, where they have, it might take multiple years to, accumulate the funds to do that, so.
That's correct.
Okay, I'm just interested to know. I think that they tried to help us to do it in a better way, so I'm hopeful that will have an impact.
Well, that's what I was going to add to that, Ms. Betts, if I may,
Sure.
Dr. Santa Cruz, that we haven't done any field trips. We haven't gone on any.
It's true.
So
that's correct.
Don't ask us for money when we're not doing anything.
True.
So we haven't even been in school. So I would expect that this is down, but I'd also know that we haven't spent it because we haven't provided our students any of those things, and a lot of it's been out of our control. Many I mean, we've not been able to offer many of the things that our students have had in years past, as far as competitions, as far as any kind of festivals, as far as anything like that or nearly like that, which is out of our control. It's partly COVID, but this is not at all a surprise to me, and I don't think we should be asking for extra money when we're not even in school. So, and I don't think until we can get back to that, I don't think that that's going to be, I wouldn't expect us to see any different, I guess, until we have those things on the table again.
I totally agree. The only reason for bringing it to your attention as a board is just because it's so clearly related to the COVID pandemic, more so probably than any of our other funds. Yeah, you are. So the remaining financial tables are all about our bond funds. So you will see some significant changes after you approve tonight's agenda as we encumber those funds for our summer projects. But there's nothing really notable on any of these grids. And it's not going for me. I don't know. Where do I point it? Is it here? I don't know where to point it. Okay, here we go. There we go. So that's the end of the monthly financial report.
Thank you, Ms. Betts. Anything else? Not, we'll move to 6.03, which is 2021 first quarter financial report.
Thank you again. We had begun the process of doing a quarterly financial 2 years ago. The idea being to show you from the quarter that we're in the current year in comparison to the quarter results from a year ago. So where the monthly report, we focus on month-over-month changes in the current year, the quarterly report is looking at quarter-over-quarter changes in comparison to the prior year. This report is late. We would expect to see something closer to the second quarter report due to the annual financial report having to be revised, et cetera. We delayed this to January. You will see the second quarter financial report at the end of February. So revenues. So again, this is back to the end of September. And if you compare 19, which is on the left, to 20, you can see that there's a very comparable look. You can see that local is about $6 million a year ago at this time. Local is about $9 million. We would expect that because we approved the 10% to 15% override. We'd also expect that the state would be slightly higher because this was the last year going into 2021 that the governor provided the 20% by 2020, the increase for teacher salaries. So all of that is as expected. The other thing that's really important here is that for the first 3 months of the school year, the state of Arizona uses our adopted budget to determine these level of revenues. So that's really important. That's why you're seeing this so favorable in comparison to the first quarter a year ago. We would see some substantive changes when we show you the second quarter financial next month. So this is just another way to look at it. You can see what we're expected to receive. So as an example, in 2009, we expected to receive $256 million. This year, we were expected to receive $277 million, only receiving $25 million and $30 million respectively. The biggest reason for that, of course, is the continued delay in the state rollover. So the state rollover impacting Gilbert Public Schools, we receive over $30 million in July of 2021 for this current year. So that's the biggest reason for that on the revenue side. And this shows the revenue by fund. And the changes that are reflected here are mostly due to timing, though you can see that the M&O was at $22 million a year ago in comparison to $28 million in the current year for the first quarter. So anything notable or any questions about any of that? Okay, great. So classroom site fund, again, that was a timing issue, and then capital again due to the timing of the payment. But we do expect an increase overall in capital due to the fact that unlike the M&O budget for the current year, capital is set because the capital fund is based upon prior year student counts. So I wanted to make sure that that was clear. So expenditures. Expenditures are really telling the same story. Pretty much, we would expect that salaries would be about salaries and benefits, again, they're 89% in comparison 2019 over 2020. The big notable change here is in benefits. Last year, at this time, it was 24%, and this year it's 22%. If you remember, going into last year, we did borrow the tax anticipation notes, and all of those went to pre-fund the benefits. So there was a little bit of a duplication in the benefits a year ago. So what's happening as of September 30th, 2020 is what we would expect at this point in time. This is, again, another look at it. I think it's interesting to see if you look at the salaries to the left on this grid, you can see that in the first quarter for 2020, we have encumbered about $167 million, but we've spent $28 million. That is close to about 1/6 of our expected yearly spend. Remember that in September 30, we've really only operated for 2 months because our teachers, paraprofessional school staff don't come back until August. So it really reflects just 2 months of spend. And then you can see, though, by the time we get to the total, we are not limited again by cash. We're limited by budget capacity. So our spend is nearer what is expected for that time frame of 2 months of operating over a total of 12 months of the school year. Any questions on that? Great. The operating expense is slightly higher, as you can see in comparison to last year, and we do attribute much of that to the cleaning protocols, utility expense, et cetera. And then the capital, slight increase in capital. If you recall, we did make a decision to increase Florida Virtual to K-12 because of the distance learning and the need for expanding Arizona Online. And so those costs were paid early in this particular quarter. And then that's all I have.
Board members, additional questions?
Well done.
Ms. Betts, once again, thank you and your team for those comprehensive and timely reports. We appreciate the effort of your staff.
I appreciate their effort too, Dr. Santa Cruz. Thank you.
Dr. McCord, anything else?
Nope. As always, great job. Thank you guys to all of our folks in finance.
Very good. We move to item 7. Item 7 is a consent agenda. You have all had an opportunity to review those items in your board packet. We can entertain a motion.
I move that we approve the consent agenda items as presented.
Thank you, Ms. Urgetti. Is there a second?
Second.
Thank you, Mrs. Humphries. It's been moved and seconded that we accept consent agenda item as presented. Any discussion? Seeing no discussion, we will vote. All those in favor of the consent agenda, please signify by saying aye.
Aye.
Those opposed, the same. Motion carries 5-0. Item 8, action items. 8.01, policy development first read, policy GCD, professional staff vacations and holidays. Dr. McCord.
Thank you, Dr. Santa Cruz. Governing board members, we have for you for first read which went through our policy committee before bringing it here, is again policy GCD, professional staff vacations and holidays. Looking at vacations, paid time off, and holiday leave details are outlined in the memorandum of understanding or in specific employment contracts. We wanted to make sure that the policy reflected the proper language.
Thank you, Dr. McCord. You've heard the explanation. Item 8.01, is there a motion?
So moved.
Thank you, Ms. Humphries. Is there a second?
Second.
Thank you, Ms. Uggetti. Any discussion on item 8.01? Appears that there is none. We will vote. All those in favor of acceptance of first read policy GCD, professional staff vacations and holidays, please signify by saying aye.
Aye.
All those opposed, the same. Motion carries 5-0. Item 8.02, policy development first read, GB, staff, personnel, security, and safety. Dr. McCord.
Thank you, Dr. Santa Cruz. Governing board members, we bring before you policy GB, staff, personal security, and safety. This has come up as something that we've had in the past in our policy related to some foot protective boots and shoes. Let me read it to you. The superintendent shall establish procedures for every employee in the school district that shall require the wearing of foot protection to complete their daily jobs. The cost of the protective boot or shoe shall be reimbursed by the district up to $100 per year. The request shall be submitted to the Director of Operations for approval. Details of eligible employee positions are included in GB-R, and the form to request reimbursements is included in GB-E. Other personal protective equipment requirements. On an as-needed basis, the superintendent shall establish procedures and requirements for staff, students, and visitors as required by the specific current environment. So there are times when some of our folks are required to wear a specific type of shoe wear, like, for example, steel-toed. And this, again, in the past, we had offered reimbursement for that, and we want to bring it back to include that back into policy so we can help out with employees.
Thank you, Dr. McCord. You have heard the explanation and had an opportunity to review this policy as well and during policy committee. Is there a motion?
So moved.
Thank you, Ms. Humphries. Is there a second?
Second.
Thank you, Ms. Uggetti. Any discussion? Seeing no discussion, we will vote. All those in favor of policy development first read, GB, staff, personal, security, and safety, please signify by saying aye.
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 Those opposed, the same. Motion carries 5-0. Item 9, future agenda items, 9.01. Once again, unless you have a burning desire to add one at this moment, please make sure you make contact with Mrs. Wilson and Dr. McCord. Place your item on their desk so that we can include it in a future meeting if necessary and appropriate. Item 10, board committee reports. Item 10.01, Gilbert Education Foundation, Ms. Humphries.
Dr. McCord shared our grants that the Gilbert Education Foundation was able to make, and I have to say I had the opportunity to read the grant applications and just see the amazing ideas that our teachers have, and with a little extra funding, they have a lot to offer our students, and we're very pleased to be able to do that, and we're very thankful for our donors and our sponsors who helped us to fund those grants to help our students out. It was very exciting.
Thank you, Ms. Humphries. Item 10.02, City of Mesa Liaison, Mrs. Wood.
I touched base with Councilmember Thompson. He didn't have anything further for me to add, just wanted to give our thanks to the City of Mesa and the District of Mesa, their partnership in allowing our staff that works in the City of Mesa to participate in the vaccines this week. hopefully
you.
our staff took advantage of that as they were notified of it, and
We don't have the breakdown just yet, but hopefully
there
we
was a
can get
good
some.
response. Okay,
Yeah.
I appreciate that. Doing all that we can in every way to make sure that we're getting our staff these vaccines. Was that the Moderna? I believe that was the Moderna.
Yes, that's the
Okay,
Moderna.
thank you.
Thank you, Ms. Wood. Item 10.03, and we'll dovetail with item 10.04, Town of Gilbert Liaison and Financial Audit Committee. Mr. Carr.
Dr. Santa Cruz, I have nothing to report at this time.
Thank you, sir. Ms. Uggetti, item 10.05, Insurance Trust.
Our meeting was canceled, so I don't have anything to report. Thank you.
Thank you, Ms. Uggetti. Item 10.06, the legislative information. Just encourage all of board members to keep track of your ASBA newsletter and the updates that come through that. This portends to be quite an active session, at least in my view, in the legislature, and it would behoove us to just be familiar with the goings-on as we can. Item 11, meeting dates, 11.01. Dr. McCord?
Thank you, Dr. Santa Cruz. Governing board members, February 2nd at 6 p.m. we will have a board work study and a brief board business meeting. February 9th, we have a scheduled board policy committee meeting, and we'll be looking to add a retreat to that in the morning from 9 to 11:30 on the same day. Then February 23rd, we have our regular board business meeting. That's it.
You did say 228, right?
No, 2:23 for the board
2:23.
business meeting.
My hearing aid failed me. Item 12, 12.01. We are at adjournment. Is there a motion?
I move that we adjourn.
Frightened me. I thought for a moment there all of us wanted to stay. Item
I'll second.
a second. Ms. Wood, thank you, Ms. Uggetti. Thank you, Ms. Wood. It's been moved and seconded that we adjourn. Is there any discussion for the good of the order? Doesn't appear so. All those in favor of adjournment, please signify by saying aye.
Aye.
Those opposed, the same. Motion carries 5-0. We are adjourned. We thank you for your attendance, both on live stream and here in the building. Have a good evening.